federal government, any liberal government, is going to respect provincial jurisdictions in healthcare. But the fact is, a huge amount of the financing of the public healthcare system in Quebec comes from the federal government. $43 billion committed by the Paul Martin government in 2004, which is run right through 2014. And what we're saying, the question was asked about accountability. I think the federal government has a role in healthcare, provided it respects provincial jurisdiction, to make sure that, you know, your access to healthcare not only doesn't depend on what's in your wallet, but doesn't depend on your postal code. We need to make sure that roughly equal services are available to Canadians across the country. That's an interest that Quebecers have. But let me just say one key thing here. This comes down to a moment of choice. You can either spend it on corporate tax breaks, multi-million-dollar expenditure on prisons, billions on jets, big gifts to upper middle class Canadians to reduce their taxes, or you can support health care. This is why this election is so important. We've got to make choices here. And if I have to choose, I'm choosing health care. That's the chief priority of Canadians right across the country. And that's why we've committed to a 6% increase after 2014. And then Patty's question is, how do we get accountability? How do we make sure that we drive reform and change in the system so the money we've got serves Canadians better? And that's why I think a federal role in health care is important.